We are using pharmaceutical packaging as a media channel of communication to patients. So the idea is that it's very difficult to reach patients because they are a minority community at the scale of the crowd, but the packaging actually is doing the job every day, very efficiently. And so we reveal that channel of contacts by having a scanner with a phone that can recognize the packaging without modifying it. We recognize the packaging and then we dematerialize, we go onto the screen, and then we can propose a certain content, service to the patient, support, nudging from a psychological standpoint, boosting of the adherence, and even helping the patient with other aspects of their life, so that promoting products that they are using in a specific way because of their disease, for example. So we host advertisements, targeted advertisements for the patients. It's extremely energetic. Actually, we see plenty of things, plenty of people who have a lot of, I would say, commitments, engagements. It's nice to see that actually many people have such a different views about the future is going to be. And it's even more, I would say, exciting when you imagine that probably the future is going to be like one of those ways. You don't know exactly which yet, but it's there already, so that's really cool. I really love that.
Desk is offices on demand, so we help companies and professionals find the best place to work from whenever and wherever they need it. I think that was a really great event. A lot of business contacts, a lot of people interested into our business, but also into discovering what Sanofi had to offer in the lab. And we were helped and supported by the whole company, so it's really great, great event.
Our solution is called Coronis, and it helps diabetic patients to be saved from the comorbidities and the complications that happen due to diabetes. We work with emerging market patients in remote locations, and we take diabetic care to their doorstep by using smart devices, by using artificial intelligence and smartphones to measure patients in their homes, link them up intelligently to the right specialists, and virtually surround each patient at home with multiple specialists who are caring for them. So the moment and our algorithm will pick up any complications that could happen in a patient and gets the right specialist involved. So many patients who today, diabetics who suffer from kidney failure, heart failure, amputation, blindness, will be saved from it. We got 2,500 patients on our platform. We have saved more than 900 from blindness in the last year. I do want to thank Sanofi for giving us an opportunity, because we got to meet with a lot of the Sanofi executives who are very supportive, very open. It gave us an understanding of how progressive Sanofi is in its digital thinking. That was really good for us. We also met a lot of other startups who are doing work in similar areas. We've been invited to many global conferences, but this is the first time where there are healthcare-focused companies. So we've all been sharing a lot of information, and we've learned from each other's ideas. I've just signed up 2 collaborations to help us expand our offerings, so it's been fantastic.
Our solution is essentially helping people discover that they have undiagnosed diseases, especially for metabolic diseases like diabetes, in emerging markets. So we're helping millions of people discover that they have a disease and get treatment so that they can get help and lead happier and healthier lives. Giant is a medical AI on your smartphone, so it will mimic the conversation between a doctor and a patient. It will ask questions about your symptoms and then lead you to the most likely medical explanation for your symptoms, and in the next step, encourage that you take action. So go see a doctor and get tested or get confirmed so that you can get your diagnosis and get treatment. And we've already helped, just in the last week, 4,000 people discover their glucose level, and about 1/3, so that's more than 1,000 lives impacted, found that they have elevated glucose levels and are diabetic or pre-diabetic. So that's what drives us and motivates us, because it's impacting people's lives in a positive way, and we can help people get better. It's amazing. I mean, you just look at the buzz that is around here, like so many companies and so many startups pitching. It's an incredibly exciting environment. And this has been 2 intense days, and I'm looking forward to tomorrow when the public is going to be here, because it's going to be insanity. So this is going to be a great experience. I'm looking forward to it. And thank you, Sanofi, for making this happen and inviting us over here from San Francisco.
So Inato is a startup that helps pharma company accelerate recruitment in the clinical trials. So the way we do this is we help pharma companies choose the right sites and the right investigators for their trials. So very concretely, how this translates today is you have, for any given trial, 3 out of 10 sites that are not going to recruit a single patient. So this obviously has very grave consequences. The way we do it is we use machine learning to scrap and to analyze all the public registries. And so this gives us access to over 200,000 sites and over 1 million investigators. And it's not only a list, it's a very precise registry.